this is Janita Mason, Medical Director at the Biosanctuary. This is another installment of the Ozone series where I'm showing you how to set up ozone so you can take care of yourself at home. And today I'm going to do a few installments actually. The first one I'm going to do is I'm going to go over some details how to actually set up and hook everything up together. Okay, so we'll get started with that first. Here is your oxygen concentrator. Now the plastic bottle that you see on the top left there comes with the unit. It's a bubbler to humidify the oxygen. However, we do not use it. We use glass bubblers here at the clinic. I do not use plastic for anything. Inevitably, the plastic, it's a soft plastic, so the plastic's going to get into the oxygen and you don't want that. Now, however, the plastic tubing that comes out of the oxygen generator and goes into the pediatric flow meter, that tubing has been treated so that it does not exchange with the oxygen gas. Now, you go into the pediatric flow meter and come out of that and go into your ozone generator, okay, chamber 1. Now, the reason why we use a pediatric flow meter is because the oxygen concentrators, its alarm goes off if it goes under about 1 or a half liter per minute. Now, most ozone therapies are at 1/8, 1/2, sometimes 3/4 liters per minute, most of them. So you want, and also you want to be exact. When you're using medical ozone, you definitely want to be very exact about your concentration so that you're not getting too much ozone or too less. Okay, neither are good. One, you're not getting the treatment that you need, and the other one can be a little too toxic. So you come out of the pediatric flow meter into your ozone generator. Now I have mine in series, so I can get the maximum output when I need it of gammas, the strongest ozone when I need it. And that's usually when I'm bubbling water and making ozone oil. I'll explain that in another segment. So we're coming into the chamber 1, and I have it in series. And since ozone is coming out of chamber 1, of course we're using the silicone tubing to put it in series. And then we come out of chamber 2. Now these are your dials. The unit does come with a chart so that you know where the dials need to be to get the gamma out that you need for the particular treatment that you're doing. So these are the specifics. Oh, one other thing here. This is a flow control. So the silicone tubing here is going to go out to the treatment, however you're hooking up for whatever treatment that you need. And I'll explain that in the next segment here. But anyway, so this is protection for your chamber so that no water or oil from the bubblers can get into the chamber and ruin your generator. Okay, so only ozone can come out, nothing can come back in. Okay, so that's the basic setup considerations.